My name is Dr. Zachary Arthurs. I'm a vascular surgeon and a vascular specialist with Coastal Vascular and Vein in Charleston, South Carolina. Today we're sharing with you a patient success story that specifically is a patient that has peripheral arterial disease. Peripheral arterial disease is very frequent and very common in patients over the age of 65. Depending on the demographics that we look at, the number of patients that have this disease can be as high as 25 to 40% in America. Once we did a full arterial disease workup, we found that she does have peripheral arterial disease and had blockages in her legs that we were able to treat. We ultimately treated Wanda first. I treated her right leg. Typically, we'll treat one leg, ensure that the patient gets a good therapeutic benefit. When I saw Wanda back for her first follow-up visit after doing that minimally invasive procedure, Wanda was a completely new person. She was ecstatic. She was able to go back to her walking. She was able to do her gardening. And most importantly, she just looked brighter.
I was concerned about not being able to walk, and I talked to Dr. Arthurs and said, "Is this thing fixable?" And he said, "Absolutely." So they operated on my right leg, and there was just minimum pain up at the groin, and in a couple of weeks it was like there was never anything wrong with my right leg. I just can't tell you the difference in the quality of my life. To be out in the yard for 6 hours yesterday, I couldn't do any of that stuff. And so today, Dr. Arthurs did the surgery on the left leg, and I believe I'm going to have the exact same results. So, if you're having some issues with your legs at all, or arms, or anything, this is the place to come, because they know exactly what they're doing and take great care of you. It's just wonderful to be able to walk, and I'm looking forward to the left leg following my right leg now. Very pleased with everything they've done. I just cannot imagine getting anything else done other than here, and Dr. Arthurs has just been superb. He is a very skillful cardiovascular surgeon. I remember just sitting down in tears and saying, I don't want to live my life like this. I don't know what to do about it. So I put up with it for so long, and my activities just ceased. So I'm looking forward after the surgery to be able to go and rejoin life and rejoin my friends. Again, I will say right out, if you've got some issues with vascular, this is the place to come, because they know what they're doing. And at 67, for me to have such a new lease on life, it's just amazing. And I'm very happy, and I'm very glad I ran into Dr. Arthurs.